Hi guys, so today I'm going to talk about care plans, and do we really even need them after nursing school? Like, once you become a nurse, do you still use care plans, and what's their importance? Why do we even do them in the first place? So going through nursing school, everyone said, oh, care plans, they're pointless. Why do we do them? You don't even do them when you get to the real nursing world, so why do we have to learn to do them now? And I'm going to say, I can't speak for every hospital, but at my hospital, we actually have care plans that are due every shift. Now, they are not as extensive as the ones in nursing school. They're a quick little page, type in some boxes, you type in the goals, you say if they're met or not met, and what the patient did or what you did to help them accomplish those goals. So even though in nursing school you do these big care plans and you may not be doing those as an actual nurse, there still are many things that you take from care plans in nursing school. And so that's what I'm going to touch on today, is why it's important to know about care plans. So I think the main goal of care plans is they make you look at your patient as a whole. And what I mean by this is you're not just looking at medications or labs or vital signs or assessments, but you're looking at the overall goals for your patient to really encompass their care. Because really, when a patient's in the hospital, why are they there? Most of the time they're there because something went wrong in their health, and there are steps that we're taking to get them back to normal or get them better. So every patient comes in the hospital that gets admitted, or maybe they're just in the ER or wherever, has goals, things that you're working to, whether it's you're trying to improve their neurofunction or you're trying to improve their breathing pattern or safety. All of these things are goals that our patients potentially have when they come in the hospital. So what care plans in nursing school teach us is how to think of these goals and then think of measurable ways to attain those goals. So yes, you have a goal, but what are we doing as nurses? What are we doing as the healthcare team to actually work towards achieving that goal? And although you may not be thinking of these goals throughout your entire shift, they're like in the back of your head. You're still doing those things. If a patient is in pain, you're going to assess them. You're going to assess where the pain is. Is it better? Is it worse? On a scale of 0 to 10, how bad is it? What type of medications are we using? Are those medications managing their pain? When we give them those medications, how quickly are they affecting? How long are they lasting? Do we need to talk to the provider about increasing their dose or changing up the medications or giving them another PRN medication? Those are all things that nurses think about. Those are the goals for that patient. The goal for that patient is pain control. And so that's something that you might see on a care plan, is pain control. Was the patient's pain met? Is it getting better? Is it getting worse? And so although you may not be putting that in a 10-page, 15-page care plan, throughout your shifts you are applying those things that you learned in nursing school. And some jobs require you to actually do care plans and write out measurable goals, things that you can see have been achieved. Like, for example, my patient's pain will be managed at their tolerable level of a 5 out of 10 throughout my shift using PRN pain medications. I will assess the patient's pain hourly and medicate as needed. I will communicate with the provider about the patient's pain. You get the idea. You're writing measurable things that your patient can achieve, or hopefully will achieve, and that you can say, yes, my patient's pain was only a 3 out of 10 throughout this entire shift. Or no, my patient had a pain level of 8 out of 10 once during this shift, and the pain medication was not adequate. So yes, you do use nursing care plans in real-world nursing. Whether you're writing down those goals or you're just thinking them in your head, you still use care plans. So I hope this video kind of clarifies, that stigma and that idea that once you're out of nursing school you don't use care plans. Yes, you're not going home and doing assignments after your nursing shifts. You're not writing a huge care plan, when you go home, but you still use them in your everyday nursing shifts and life. Thank you guys for watching this video. Give me your thoughts on care plans, whether it's a good thought or a bad thought, why you think we need them, why you think we don't need them. Leave those in the comments below. Give me a thumbs up and subscribe to my channel, and I'll see you next time. Bye.